Now, let's welcome Dr. Kevin Cahill of Coastal Spine Institute. Dr. Cahill, we are so happy to have you here today.
Thank you for having me. It's a pleasure.
We're really excited to get to know you. I know that you have a relatively new practice in town, and we're excited to hear about your office and about you. So let's start with you. Tell me a little bit about your education and your training.
Sure. So I grew up in New Jersey and then moved to Florida at a pretty young age.
Oh.
And did my undergraduate medical school and graduate school training at the University of Florida.
Great.
After that, I then did my neurosurgery residency at Harvard, and that was followed by a fellowship in spine surgery at Jackson Memorial Hospital in Miami. After that, I then worked in Charlotte for 5 years with a very large neurosurgery group, and moved from there to this area.
So when you hear the word neurosurgery, some folks automatically think brain, but that's not the case with you, is that correct?
That's right. So I get that question all the time, how did you end up in Brunswick County, and how come you specialize in spine surgery? Well, you're right, neurosurgeons do brain surgery and spine surgery, and I've always been interested in spine surgery. Even in residency, fellowship, it's just been my passion to do spine surgery. I'd never really got involved in the cranial surgery. So when we started looking for a place to open a spine surgery practice, we wanted to find an area where we could do spine surgery and have nice hospitals to work out of, and that's why we're here. Yeah,
and there's a lot of hardworking people in this area who injure their backs.
That's right. It really, in terms of spine surgery and neurosurgery, it's an underserved area, and patients were traveling, an hour to see a neurosurgeon, and it really was a great opportunity to provide local care and save people from driving back and forth for visits.
Right, yeah. So your practice is called Coastal Spine Institute?
That's correct, Coastal Spine Institute. Yes.
Great, and tell us where that's located.
Sure. We are just down the road from Novant Hospital. We're right across from the old hospital on 17. Mm-hmm. We're on the right-hand side going south.
Yeah.
That's correct.
Yeah. Let's talk a little bit about the range of services that you offer at your clinic.
Sure. So basically, at the practice, it's myself and Leanne Kennedy. She's our physician assistant. We both see patients in the office about 3 days a week, and we focus on patients with spinal disorders. And we see a full spectrum of patients, from patients who walk in and say, "Doc, my neck hurts," to patients who have had 4 opinions in various cities and want a 5th opinion about their prior lumbar fusion. So we really see the whole spectrum of patients with neck and back problems. We see patients who've had spine surgery before.
That's what I wondered. Do you see patients who've already had spine surgery?
Sure. And I'd say that's probably about 25% of the patients we see. A lot of patients who have degenerative conditions in the spine and the low back also have problems in the neck, and vice versa. So we see quite a few patients who have been through the process before and are now excited to have an option closer to home.
Of the patients that you see, have most of them seen their primary care already?
I'd say about half.
Really?
Maybe a little more than that. We definitely get referrals from primary care doctors for patients with spine problems, but we also have patients who have found us and want an evaluation. So nowadays there's such a range with the different insurance carriers and policies about getting referrals that a lot of them don't require it anymore. So we often see patients, second opinions from other practices in the area and things like that.
But you do see patients who do not have a referral? They sort of self-refer to you?
Absolutely. We see patients who maybe fell last week and have back pain and want to come in and get evaluated. So we're happy to do that.
So if someone's sitting at home right now and they have significant back pain, you recommend that they just call the office. And
Well, yeah, I mean, I think, back pain is, there's varying degrees of back
Sure.
pain. And back pain is very common. In fact, it's the second most common reason why people visit a doctor.
Really?
So we really get involved when that back pain is significant and it doesn't go away with time, and especially if there is any neurologic involvement, meaning your legs or your arms are not working well. So signs that this is more than your run-of-the-mill back pain exacerbation. That this is something that needs an evaluation by specialists.
Yeah. So tell me what the first steps are. A patient walks into your office, first time you've seen the patient. Where do you begin?
Sure. We like to get a good history of the pain, and we definitely are on the lookout for some of those things that we talked about, whether there's weakness involved,
Right.
whether the pain goes down into the arms or the legs, whether they've had back surgery or neck surgery before.
Yeah.
We try to get a good understanding of the patient's medical condition, and we try to do a very detailed evaluation and neurologic examination to help determine if there's any signs that the nerves are being compressed or the nerves aren't working.
Right.
If those are present, it really puts you into a category where you need an additional workup step, which is typically nowadays an MRI.
I see.
We sometimes start with x-rays, but often if there's signs of a nerve not working, we move right to an MRI. And that's very helpful for figuring out what the best treatment is. The MRI will show in detail what's going on with your spine, and that's one of the main studies we use to make decisions regarding treatment.
So if a spine surgery is indicated on this patient, am I correct that you are on medical staff at Novant Health Brunswick Medical Center?
Correct. We've been doing spine surgery there almost a year. We started the practice last spring. We do surgeries on Mondays at Novant, and I've worked at hospitals at Harvard and Miami, and we have one of the most dedicated spine teams that I've worked with. We have a very, very nice equipment and really a dedicated, committed spine team. And so we've been doing surgery now almost a year there with fantastic results, and it's really been a nice place to work.
Great, that's great news and great to hear. I know there's likely a range of recovery experiences, but can you talk to me a little bit about what you would expect, what patients can expect?
Absolutely. There is a huge range.
I'm sure.
There's definitely been a focus over the last probably 10 years of developing surgeries that have a quicker recovery, and that's where minimally invasive spine surgery comes into play. Some conditions can be treated that way, and a lot of those surgeries that we do are outpatient procedures.
Right.
So people go home from the hospital the same day. The recovery from those operations can be very quick, and people want to get back to work and want to get back to activities. And it may be a week or two of recovery, maybe some physical therapy, and then back to normal. Other conditions may not be that simple. And some people may have problems at multiple levels in their spine, and they may not be a candidate for a very small, minimally invasive surgery. So we really do the full spectrum of operations. So some operations, the patient may be in the hospital for several days and may have a couple weeks of recovery. But again, we try to do the least invasive surgery possible, and the recovery time for those smaller procedures can be very quick.
Well, it's been wonderful to have you here. It's great
you.
information, and I can't wait to have you come back. So if there are folks out there who would like to make an appointment, how might they do that?
Yes, so we are online at coastalspineinstitute.com. We have online scheduling.
You have a very nice website, by the way. I've checked it out.
I appreciate that. And then we have a full office staff that are available during the day, and the phone number is 910-356-6100, and they'd be happy to take an appointment.
Thank you again. It was such a pleasure.
Thank you, Jim.